let's do the next case. This is Mary. Her case details are, this will also be monolithic zirconia. Impression technique, again, will be analog. And again, the pickup of the prosthesis will be at the lab. So each of these cases has a little different twist that talks about case design. And with Mary, her complaint was that her lower denture is loose. Can I get something more like my upper denture that I don't have to remove? So she already had a fixed hybrid type of prosthesis on the top. And her lower overdenture was popping out on her. And if you look at it closely, you can see that all of her locator abutments are worn, except for this very back one over here. And so what I offered her was, I offered her a screw retain. She didn't want to spend that much money. I gave her the other option of locator fixed, and she opted to move forward with the locator fixed. And that's just an X-ray of her upper. I think she was in a PMMA at this time on the upper, and what so you can't see the PMMA and you can't see the lower overdenture, but the prostheses are in place for this X-ray. Okay, so at our first appointment, we're going to remove the damaged locator abutments. We're going to measure the heights. We're going to order our new locators. Once we get the locators, we're going to take a preliminary fixed closed tray impression using that Idenium by Kettenbach. And on the opposing arch, we can either do a conventional analog impression, or since it's screwed in, sometimes I'll take a digital scan and have the lab print a model so we don't get it caught underneath that fixed prosthesis. We'll do our cois, we'll do our face bow, and then with for the initial impression, we're going to use this Idenium material. This is called Panasil. These are the closed tray impression copings for Straumann's bone level implant. And with these impression copings, they have a little cap that snaps onto the top. So when you take the impression, that cap stays within the impression, and then you put the analog and it snaps into the cap. So we take our impression, we add our analogs to the impression, and then we're going to pour our gingival moulage. And with these fixed type of cases, whether they're screw retained or whether they're locator fixed, if the work is being done on the model and you want it very accurate, we always want to box our impressions. You don't want to pour these impressions and then invert them and have the sag. It really does create some inaccuracies in our impressions. So we box our impression, we mix our stone, we measure the proper water to powder ratio, we vacuum mix the stone, and we pour these models and let them set for 24 hours before we separate them. So here's our models before we separate, and here's after we've separated it. Now we have to fabricate the jig impression so that we can create a more accurate. You got a question?
Well, just about the impression. Do you like the fixture level impression versus the little snap-on parts from Zest? They just go over the abutments.
Well, so if we were just going to make a denture, and we were going to pick up the clips or the inserts in the mouth, then we could use the locator impression posts because we'd be replicating the locators in the mouth. Okay. But because we're picking up the inserts in the lab, okay, I have to be able to take those locators in and out from the mouth. Yeah.
To the
Mm-hmm.
Okay.
Yep. Okay. All right, so we're gonna fabricate an impression jig. We're gonna measure the cuff heights for the new abutments, and then we're going to fabricate a custom tray. So the way that we fabricate these jigs is we take our open tray impression copings, okay? So these impressions will be unscrewed after we take the impression in the mouth, and we'll run some floss across, and then we'll use a material like Duralay. There's another material called Primatech, and we'll connect these all together so that when we take that impression, we're going to be rigidly splinted. Nothing's going to be moving. And so here's our impression jig. And then before we cut this to bring it to the mouth and reconnect it in the mouth, we're going to make a custom tray. So we're going to use some wax material to make spacers so we can have even amount of material impression material, which will also increase the accuracy of the model. And then we want to have enough space that the screw holes will come out of the top, so when we're going to take the impression, we're not hunting for those screw holes. And then we're going to use a light cured material, which we use this Prima tray material. It used to be Triad material. We're going to create our custom tray. We're going to make sure that the screw holes are clear. We're going to throw that in the light and cure it. And then we're going to open up those holes a little bit more. So when we're placing that impression tray, we're not hunting for the screws. And you always want to leave a little bit of space around the impression tray because that material has some body to it, and you'll be able to border mold that material and give you a really nice master cast. So there's our final custom tray with our impression jig. And now we're going to cut this jig so we can get rid of the shrinkage inaccuracy. And then we're going to bring this to the mouth, and we're going to reconnect it with the same material that we built it with. Because now we're just using really minute amount of material, so you're not going to have that shrinkage that's going to cause that inaccuracy. So here's our jig in the mouth after we've reconnected it. And we're going to place adhesive in the tray. It's very important to use adhesive in the tray because if that material is pulling away from the tray, you're going to introduce some inaccuracies. And there's the material that we use, the Idenium. And again, I use a light body to syringe underneath the impression jig while my assistant's filling the tray with a medium viscosity material to take a real accurate impression. And so there's our final impression again. We're going to place our analog just like we did for that preliminary model we fabricated. I'm going to do the same thing, more important this time, because this is going to be the model that we're fabricating the final prosthesis in. But you can see that we're extending into the retromylohyoid areas. We have real nice borders all the way around. We've covered the retromolar pads because if we're doing an analog technique, we're going to make base plates and rims. We're going to try it in, and we want this to all be stable while we're going through the procedures to get to the final prosthesis. So now we have our master cast. We're going to place our locator abutments. And then we're going to do just like I said. We're going to make a base plate. We're going to make a wax rim. We're going to determine VDO. We're going to have a wax try-in, all the basic prosthodontic principles that you would use when you're making a conventional denture. All right, so for the laboratory work authorization, we say, please scan upper and lower models and the bite at the vertical dimension by the mandibular. I made a mistake and wrote prototype, meant to be setup. Scan the lower model without the setup. Make sure the scan captures the vestibules and retromylohyoid areas and land areas. Fabricate a printed prototype replicating the position of the given setup. We tell them the molds of the teeth because sometimes they have those molds in their libraries and they can just match them. Create relief around the locator abutments for pickup of the processing spacers intraorally. And a little twist to this one, I wrote, this can be designed like a denture, but windows that will allow me to cut off the flanges after I pick up the processing housings. Fit the prosthetic to the model after printing by using spray and adjusting the intaglio so it seats and the pin is at the same vertical dimension as the wax. So once they fabricate the denture, it's not going to really fit on that model because there's undercuts. So what I do or have them do is spray the denture with green spray, fit it to the model, have them adjust it until that denture seats all the way down on the model, because that's going to act like a prototype that will scan for the final prosthesis, because this is going to be a prototype that we're going to fabricate. Okay, so here's the prototype. This is not going to be the final prosthesis, but it's going to be something that she wears to make sure that she's happy with it and that I'm happy with it. And I have them in the design make these cutouts. They're not putting this in after the fact. When it's printing, these cutouts are possible, so that after I pick the clips up, I have less grinding to do, less discs, less burrs. It comes apart a little bit easier. All right, so now we have our locators. This time I have enough of those little spacers to block out the undercuts. Before we do the pickup, we're going to pip the denture, we're going to adjust occlusion, we're going to verify centric relation and vertical dimension, evaluate the passivity. We're going to use this chair side material to do the pickup in this case, because that's the best material to use with these printed dentures. And then there's the prosthetic with the black housings. The chair side material takes about 5 minutes to set. Now we'll use we'll try this in. We'll go to the lab and cut off the flanges, polish it, get the intaglio nice and smooth, get rid of any concavities. Remove our black housings with our removal tool and place in our green housings. So there's our final prototype. I'm going to send the patient home, let her wear this denture for about 2 weeks, tell her to take notes, evaluate what she likes, what she doesn't like, to go ahead and eat normally, except with a little bit of a softer diet, no things like pretzels and peanuts and stuff that's really hard. And then when she comes back, we're going to check all of the criteria: the aesthetics, the phonetics, the comfort, the cleansability, and the occlusion. And in her case, she was happy as could be. There was nothing really negative that she felt she wanted to change. And so now we want to replicate that prosthesis in a monolithic zirconium prosthesis. So we're going to take a bite registration. We're going to take out the locator fixed. We're going to snap it onto the master model. We're going to do a remount with our bite registration because there was some adjustments when we seated that prosthetic. And then we're going to send it to the lab for scanning of for the final zirconia. Now, with these types of cases, sometimes we put the patient back in their previous prosthesis while the lab is doing this, or sometimes we will send the patient with the prosthesis with the opposing model, have them go to the lab, and they'll wait here at the lab while the lab scans it, and then they'll come back to my office and I'll put them back in that prosthetic. On this case, I think we put her old locators back in and put her in her other prosthesis for just like a day or two, and then we got the case back from the lab after they did their scanning.